A possible variation with a joint movement for repeated movement testing or repeated movements as treatment is traction. And kind of like ballistic force alternatives with these movements, I don't use traction that often. I do use sustained more commonly, but traction is typically just in a few joints that I might consider it. We use traction with cervical retraction extension and supine when the clinician applies some traction. I may use it with knee flexion by placing a towel behind the knee and allowing a little bit more space when the joint flexes. Sometimes I've seen colleagues use it with hip movements. The wrist, though, is where we more commonly apply traction. And traction simply means separating the joint surfaces. So alone, I don't think traction does much. I often get that question from patients about inversion tables. And while yes, I want things that are pain relieving or helpful for patients who have no other recourses, I don't find that traction resolves disorders. If you separate the joints, but then go back to it being normal, relocating back to its normal position, what have you really accomplished other than that temporary separation, which may be pain relieving in the moment or for a little bit after? When I use traction, it's in combination with a movement to possibly, we're exploring, make the movement more beneficial. And sometimes we use traction just at the initial stages to jumpstart the procedure or jumpstart the therapy, and then traction is no longer needed. But for the wrist, again, we use it more commonly. Traction of the wrist is very obvious to see. When you pull on the hand, you can see that separation in the joint line between the carpal bones of the wrist and the distal radius and ulna of the forearm. So when I'm using traction as part of repeated movement testing of the wrist, I'll choose the direction, such as flexion, and then instead of just flexing the wrist, I may investigate as a test what happens to the patient's signs and symptoms when we apply traction to the wrist and then flex it. Or we could do traction of the wrist, kind of like this, and then extension. Or even traction and then radial or ulnar deviation. Other movements I use pronation and supination of the wrist. I haven't experimented with using traction there, but of course you could. So think of traction as another kind of alternative, a variation to a movement, just like a ballistic movement might be a variation or a sustained movement. And know that when it comes to which joints use traction most, the wrist is up there in terms of, we find that it might not respond to just wrist flexion or extension, but the joint derangement, that mechanical problem, might better respond if we give it some separation and then proceed into the movement.